Hello, everyone. Welcome to my presentation of the 1619 article project. My article of choice is called A Broken Healthcare System by Janine Interlandi. Now, let's start off with a thought experiment. Parkour is a very trendy sport. Unfortunately, you landed the wrong way, which result in a broken arm. Thank God you bring your insurance card to the emergency room. However, the location of your stunt is in Ontario, Canada, and this place was notoriously known of their great healthcare, universal healthcare that they provided to the citizen. And after all of that extensive procedure at the ER, the price you ended up is $0, or another way of saying it, a price of a cup of water. However, if you switch your stunt location to Massachusetts in USA, the total bill cost of 21.90 with insurance is equivalent to the price of 3 months rent in Worcester. And this include the deductible, copay, and the out-of-network provider. All the complexity, despite that you have insurance. Now you might ask the question, why is it like this? How is a great country like the America, fail to have universal healthcare? It all have to do with race. Let's start off with the overview of the article. The history of racism in healthcare has been prevalent for a while, and ever since the country formation, African American have experienced disparity between their doctors, between healthcare worker, between healthcare policies, and it's a combination of multiple factors, which is the complexity of insurance policies that segregated certain communities, the lack of accessible supporting infrastructure and program, and despite that we do have Medicare and Medicaid in nowadays, statewide still experience incompliances. Now that's the example of this that we can see right now, stated in the article, is smallpox compared to coronavirus, a pandemic that we're going on right now. Similarly, both in both places or in both timeline, smallpox, similar to coronavirus, is very contagious and it spread ravagely, like violently, throughout the communities of blacks, newly freed black, and they spread so much because of the lack of preventive measure like quarantine and social distancing, poor sanitation of hygiene, and poor nutrition. Early doctor in the 1870s understand that the implication of these measures will decrease the fatality of the disease. Now you can see this because the white neighborhood, or along with the Union Army, they remain the same, relatively unscattered from the infection. However, for the coronavirus, a similar case can be observed where black communities or black counties have lack of supported infrastructure, the lack of COVID testing, the lack of offering places to test, and if you don't have insurance, testing can be very expensive. Also, the decrease in preventive measure, decrease in information that spread out, and an example of this is Cook County, an Illinois studies and survey. They showed that black mortality rate is 1.3 times higher than their population share. Now, when we take a look over the data from the CDC, we can see that compared to their population share, blacks have the highest fatality or higher fatality in comparison to other minority group. And as you can see around in Alabama or AL, the percentage of death is significantly higher than their share, and it's got worse. And there's places like Georgia, LA, Miami, and the worst place that you can see on here is South Carolina with 53% in comparison to the population share of 28%. Now, the origin of these segregated policies stemming from the racist belief that a long time ago that healthy population of African American would fuel an uprising. Now, this is a ridiculous policies or a train of thoughts, we put it as this day. nowhere near our current thinking. And despite multiple reform throughout many decades, segregated policy is still embedded in American healthcare system. Now, this leads to medical neglection and decrease in the quality of care. An example of this is a case study in 2016. The methodology of the experiments is a pool of 60 applicants that were sent to their appointment, and whatever they talked with the doctor, the transcript was provided. And what they found after analyzing the transcript of the conversation during that visit is that black patients, particularly women, experience medical distress during their visit. And oftentimes, the physician would have poor communication or disregard many symptoms presented by the patient. And sometimes they leave the patient confused that is this some type of form of segregation or it's just poor communication. It's very disheartening to figure this out. And another reason of this systemic complication is that the system of insurance. Some beneficial aspect of insurance is that it helped a lot with the medical bills, and the introduction of Medicare, Medicaid, increased the affordability of insurance to many people. Many people didn't have insurance before. Now they can get it for free through the government. However, of course, this have some complicated limitation. One of the most important aspect of the insurance is that high deductible rate and high copay. If the provider or the physician that see you does not have an insurance plan, they would count as out of pocket cost. You can have a whole ride. You can have the insurance. You can have the ambulance covered. You can have the hospital that the insurance covered. But if the physician that see you is not in network or another case have a contract with the insurance, they would bill you directly without any coverage. And with the use of Medicare and Medicaid, it's covered somewhat, but not all of it. Maybe like a very small percentage. And Medicare only beneficial a lot of 65-year-old elderlies and above, not below that. And despite that, we can still see Medicaid help mortality rate. This is a graph extracted from a study. It showed the age-adjusted elderly mortality rate, and the straight line you can see in 1965, at the year that Medicare was introduced, and ever since mortality rate just bunkered. It just go down and down to roughly the 2000s, and as you can see, the vicious cycle of race in healthcare is contributed by many factors. Like the majority of low-income neighborhood is the minority group. And another thing is that redlining caused disparity in healthcare for African American. And a lot of minority group receive less funding and less resources in comparison to their white counterpart. And it was stressed a lot in the article. She said that after a few while of reform, but nothing changed. And this led to the introduction of Medicare and Medicaid. But however, as we all know, this does not help much for the overall population. And that's it. That's the end of my presentation. I hope you guys enjoy, and here's my sources. Thank you.